Joining me today are Secretary of Human Services, Lourdes Padilla, and Dr. Jinlene Chan from the Maryland Department of Health. We're here to announce some new initiatives and additional investments to protect the health and safety of Marylanders from COVID-19. First, I want to provide an update on the latest metrics in our fight against this deadly virus. As of this morning, Maryland has had 159,900 confirmed cases of COVID-19, including an additional 1,477 cases over the past 24 hours. There were 144,000 new cases across the U.S. yesterday, the nation's largest one-day total ever. And it's the 9th straight day that new cases have topped the 100,000 mark. Today, Maryland's 7-day positivity rate increased once again to 5.65%, and half of our 24 jurisdictions now have positivity rates above 5%, including Allegheny, Anne Arundel, Baltimore City, Baltimore County, Charles, Frederick, Garrett, Hartford, Prince George's, Queen Anne's, Somerset, and Washington counties. Our COVID hospitalizations increased by 53% over the past 2 weeks. Today, 863 COVID patients are currently hospitalized in Maryland, which is our highest level since June 11th. 199 patients are currently in intensive care units, which is the highest level we have had since June 25th. Nationwide, we're now averaging over 1,600 additional new hospitalizations each day over the day before. And yesterday, COVID-19 hospitalizations in the U.S. surged to their highest level ever, with 64,000 patients hospitalized. Maryland is now in the red zone for case rates, as designated by the federal government. And while we remain lower than 37 other states, our average cases per 100,000 has risen to 22.8, which is a 52% increase in just the last 7 days. Our case rates have now risen above 10 in 22 out of our 24 jurisdictions and above 20 in 10 jurisdictions. So far, the virus has taken the lives of 4,112 Marylanders and over 247,000 Americans. 1,421 Americans, including 12 more Marylanders, died in the past 24 hours. Our entire COVID response team is on high alert, and we will continue to constantly monitor all of the public health metrics here in Maryland, as well as the spiking numbers in the region and across the country. We are experiencing an out-of-control spike across the United States, and we are seeing widespread community transmission here in Maryland. Thanks to the vigilance of the people of Maryland, our metrics currently remain better than most of the nation. We're also in a much better position than we were this spring, and Maryland is much better prepared than most states to be able to withstand this very significant surge. More than 460,000 Marylanders subscribed to our MD COVID Alert contact tracing app in just the last 48 hours since its launch. This is an important tool in our fight against COVID-19, and we are encouraging everyone to opt in, which will help us stop the spread and protect our fellow Marylanders. The weeks and the months ahead are going to be very difficult, with more and more people getting infected, being hospitalized, and losing their lives. Our collective actions now will determine what further steps will be needed. As we renew and redouble our efforts to flatten the curve once again, we're also committed to doing everything we can to help struggling Maryland families and small businesses who are desperately in need of additional and immediate relief. The gridlock in Washington and continued failure of both parties to reach any compromise on the next stimulus package is having a devastating impact on our business community and on the lives of our citizens. Our leaders in Washington, on both sides of the aisle, need to put the politics aside, do their jobs, and get this done for the American people. 81,000 Maryland businesses have already received $10 billion in PPP funding. We've already paid out now nearly $8 billion in unemployment assistance to more than 640,000 Marylanders. State of Maryland has also previously provided $250 million in funding for emergency economic relief, including more than 10,000 grants and loans to small businesses and nonprofits. Last month, we doubled our state relief investment to $500 million to fund a combination of new small business relief programs to protect jobs and to expand our existing successful programs in order to immediately provide additional desperately needed relief to the businesses and their employees who are most in need. This includes a new $50 million in direct relief for restaurants, which the state is distributing through and by our county governments. Many of them have already begun accepting applications for these state funds, and we are again calling on the other counties to immediately do so. Counties have also been given significant CARES Act funding, which must be distributed within the next 48 days or it will be forfeited. We have asked our county governments to match our state dollars by utilizing this federal CARES Act funding. I want to commend Anne Arundel County officials for agreeing to match the state's investment in this important program, and we urge the other counties to do so as well. We committed an additional $50 million for the third installment of our Small Business COVID Relief Grant Fund. The Department of Commerce is currently processing hundreds of applications daily, and that money will begin going out in the coming days. We also tripled our investment in the state's COVID-19 Layoff Aversion Fund, and the Department of Labor already began distributing over $5.7 million in new payments to businesses earlier this week. Over 12,000 jobs have been saved through this program so far, with more help on the way. We are also making rapid progress on getting additional funding out for initiatives to help Main Street businesses, entertainment venues, and local tourism and arts organizations. I directed our team and multiple agencies to distribute these relief funds immediately. Any struggling small business owners who need assistance should go to open.maryland.gov to learn more about these economic relief programs. Today, we are announcing another $70 million in targeted investments utilizing CARES Act funding to further bolster our emergency response to this COVID-19 surge. First, we're adding another $20 million to continue building up our strategic stockpile of PPE. Federal officials have encouraged states to have 60-day supplies, but we are meeting and in many cases already exceeding our goal of stockpiling 90-day supplies of the most critical resources. Earlier this week, state budget officials reached out again to county leaders to strongly encourage them to use some of their remaining CARES Act resources to build up their supplies of critical PPE, especially gloves, gowns, and masks. We're providing an additional $15 million to the Maryland Department of Labor to have even more staffing to again ramp up the call center and to invest in more adjudication staffing, customer service management software, and to beef up our successful fraud detection programming, which has already helped us save more than $500 million in tax dollars. Today, we are doubling our investment in the Rental Housing Assistance Program, adding another $10 million to cover rent payments for low-income tenants who have been negatively affected by the COVID-19 crisis. This program has already provided more than 4,500 families, Maryland families, with assistance, and is currently accepting new applications in order to assist far more. 40 Maryland companies are currently working on developing and manufacturing COVID-19 vaccines and innovative therapeutics, including Novavax, which is adding another 400 jobs here in Maryland and was awarded $1.6 billion through Operation Warp Speed to complete late-stage clinical development and to establish large-scale manufacturing in order to deliver 100 million vaccine doses as early as late this year. Earlier this week, in addition to the encouraging news from Pfizer, Novavax received a fast-track designation from the FDA for their vaccine. Back in April, our team at the Maryland Department of Health began an interagency process to develop a plan for ordering, distributing, and administering COVID-19 vaccines. Last month, we submitted our draft vaccination distribution plan to the CDC, prioritizing vulnerable populations, including older Marylanders, healthcare workers, first responders, and others on the front lines of the pandemic. Today, we are providing the initial funding of that plan with an initial investment of $10 million for the acquisition of syringes and other necessary vaccination supplies. Over the past 8 months, we built a COVID-19 infrastructure from scratch, but this vaccination plan will be yet another unprecedented undertaking for our state. Working closely with our hospitals and healthcare providers, we will continue to aggressively prepare so that we are ready to act immediately when a vaccine becomes available. Today, we are also providing $10 million in additional support for Maryland food banks. As part of our Maryland Unites initiative, food banks across our state have stepped up during this crisis in a truly inspiring way to help people in need. In order to bolster their efforts, this spring, the state invested another $4 million to the Maryland Food Bank and the Capital Area Food Bank. We work together with local jurisdictions to match that investment, and with the holiday season approaching today, we are more than doubling our state commitment with this additional $10 million. We are investing an additional $2 million in emergency supplemental funds for foster care providers to help support the needs of the youth entrusted to their care. This funding will be used to increase staffing, housing, case management services, food, transportation, and cleaning supplies. Another $2 million in CARES Act funding will enable the Maryland Department of Human Services to increase call handling capacity, to extend their daily hours of operation, and to add weekend operations specifically to assist in managing the increase in SNAP benefit requests and energy assistance programs. Finally, today we are dedicating $1 million for an innovative wastewater sampling program by the Maryland Department of Health and the Maryland Department of the Environment to help detect COVID outbreaks in vulnerable populations. This partnership between state and local health departments will test wastewater in public housing settings and correctional facilities across the state. This science-based, field-tested program will help provide us more data to detect and respond to outbreaks and to help us save more lives. The $70 million of new investments I'm announcing today will help us to protect the health and safety of more Marylanders. We're once again asking our county government partners to do their part as well by utilizing their remaining CARES Act funding ahead of the expiration of those funds in 48 days. I want to commend Baltimore County on this week's announcement that $11.5 million in CARES Act funding will be utilized to help public schools prepare to reopen and to provide additional relief for restaurants. And Harford County also announced $2 million in CARES Act funding this week to support local fire department and EMS organizations, which have been overwhelmed on the front lines of the pandemic. Some counties, however, have not yet allocated or dispersed the bulk of the assistance funding which has already been provided to them to help citizens and small businesses in their communities. The state passed through more than $362 million in federal CARES Act funding through to 19 of our smaller counties, while the largest 5 counties received another $691 million directly from the federal government in CARES Act funding. This money is required by law to be spent by the end of the calendar year. And so we're again calling on all 24 jurisdictions to immediately get this funding out the door to the struggling Marylanders and small businesses who need it the most. And I've always told it to you straight, and the sad truth is that the next several months will likely be, by far, the most difficult that we have faced. And I want to continue to remind everyone that this truly is an all-hands-on-deck operation. Unfortunately, we have more tough times ahead of us, and it's likely going to get worse before it gets better. But we truly are all in this together, and if we all do our part to rise to this challenge and to meet this moment, we will get through this together. So thank you, and with that, I'll be happy to take some questions.
Yeah. Across the region today, we saw local leaders announcing more restrictions and issuing stern warnings against family gatherings. Do you support those restrictions, and are you rethinking your decision not to go farther with statewide restrictions?
Well, as we've said almost at every one of our 60 press conferences over the past 6 or 9 months or so, the state law provides for local governments to make their own decisions that can be more restrictive than the state. We're very comfortable with the decisions we've made statewide, and we've left the flexibility with the counties to make their own decisions. We're going to continue to track the metrics and make our decisions every day as we see fit.
Governor, with regard to the darn masks, County Executive also Brooks in Prince George's County today issued a mandatory mask order. If you're outside your house, you got to wear a mask, no matter who you're with. And I've looked at the modeling of this progression, and there's a big difference with universal mask wearing. Are you considering a statewide mask order?
We have a universal statewide mask order, which has been in effect since the spring, and we've been calling on our local leaders to help enforce that because they have not been, I think, doing a very good job of doing that. But it's for all indoor public places and every business, every public space, and outdoors whenever you cannot socially distance or be 6 feet apart. It still remains in effect statewide, so they don't need to do anything different on that one at the county level.
Governor, last week, Dr. Marcosi spoke of how serious mental health concerns are in this time and how serious it will be going forward in the next few difficult months. Is the state planning anything, maybe a task force or any care act resources to address mental health issues statewide?
So the Lieutenant Governor was appointed several months ago to chair a mental health task force, and they are meeting with stakeholders and people throughout the government to talk about. There's no question. We're seeing this throughout our departments. Suicides are up, problems with substance abuse, domestic abuse. People are under incredible pressures, and this is a problem that we're trying to address, and through our health department and through DHS and a number of other places, where we're trying to help people as much as we can through our youth programs and through multiple departments. This is going to continue to be a crisis. I mean, it's the health crisis, the economic crisis, and the mental health crisis.
So Governor Hogan, I'm not sure if you could maybe boil down some of the most recent modeling you've seen, or if maybe the doctor could. I know over the summer we would see worst case scenario, best case scenario. If people don't change their habits, how bad could it get, and when could we get there?
Well, we see different modeling from different places. So obviously we do our own internal modeling at the Department of Health. We work very closely with Johns Hopkins. We're looking at the Harvard modeling, and we get input from some of the smartest public health professionals and scientists and doctors. The numbers, as you hear talking about nationally, could be much worse than they were in the spring, but I don't want to give a specific number of what the modeling was. If you remember back at the beginning of this in March, Johns Hopkins was saying we would have more than 12,900 Marylanders dead by June 1st, and we thankfully were able to avoid that with a lot of hard work by a lot of people and people really listening to the advice. We're telling you again that you really can change the trajectory of those numbers. And, we really did have a situation back in the spring where we had our hospitals overloaded. We didn't have enough ICU beds. We didn't have enough ventilators. We had to rent an ice rink to stack dead bodies because all of the all of the funeral homes and the morgues were overloaded. We do not want to be in that situation again.
Governor, when was the last time you talked to Dr. Fauci? You said before that you had pretty regular conversations with him, or for that matter, anyone on the President's coronavirus task force as we see the transition happen.
I guess we had a group call with the coronavirus task force the day before the election, I think, Monday. I haven't had a conversation with anybody on the coronavirus task force since then. It's one of the things I'm frustrated about because, look, I understand we just went through a contentious election, but it really is becoming a problem in that I think the people in the White House are focused on, fighting elections, and the people in the Biden administration don't have any information and haven't taken over, and there's a little bit of a vacuum right now. The states are out here fighting probably the worst part of the crisis we've ever had to deal with, and we don't really know what's going on at the federal level, and we don't see any action out of Congress either. It's still bickering, still fighting, still not reaching compromise, which is very frustrating to us that are out here trying to save lives. Yeah. Yeah.
As regard to the rental assistance, is there going to be a deadline to release those funds, especially with the CDC eviction moratorium coming up at the end of the year?
Yeah, well, so our Department of Housing and Community Development, as I mentioned earlier, that they've been able to help 4,500 people with the rental assistance already. They were out of money, so we can put more money in, and we're going to try to get those dollars out the door as fast as we get the applications in. So they had a little bit of a backlog that they can now help, and then we're opening up the application process again to see if we can help some more folks. But we want to get it out to them as quickly as we can. Maybe I'll let Dr. Chan talk about that. Sorry.
Thank you. So the Maryland Department of Health has been working with the Maryland Department of Environment over the last several months on a pilot program looking at how testing actually of wastewater from certain facilities, for example, may be able to detect the presence of coronavirus in the wastewater. And so that testing then allows us to potentially predict or then go back and do more specific testing of the people within the facility. The funding that the governor has dedicated to this project will be very targeted initially. We are working, as he indicated, with the Department of Corrections at the state level because there certainly has been an impact in the correctional facilities, and then also looking at how we can detect coronavirus that might be circulating among particularly low-income public housing that care for seniors. And so that's where the initial work is currently looking at being done.
Dr. Shanahan, could I ask, is there a metric that you're looking at right now in regards to schools, and I know the superintendent's not with us today, that you would make a recommendation as to whether or not schools who are currently having in-person classes need to return to online instruction?
I think that the metrics that we put out earlier this year still would stand, and as the governor indicated, those metrics in many of the counties are higher than what we had indicated. However, it ultimately is the decision of the local school board in conjunction with the local health department. What we would still encourage is that, as we balance all of the different actions that different counties are taking, understanding, and we just talked about the mental health impact, that, kids' mental health is also important, and to the extent that we can care for the kids still, even in this circumstance, trying to balance those needs as well of the educational and the mental health needs for children.
Let me just weigh in on those two things quickly. Sorry, Mackenzie. I agree with the doctor. Our metrics haven't changed on the schools, and we want to keep a close eye on that and work together with our local school systems. And I know both the health department and the superintendent of state schools is doing just that, I think, on almost a daily basis. And with respect to the wastewater treatment plant, we had done the testing to see if this worked before, and the studies are done, and now we're funding it, at least on a targeted basis, to start with our populations that we thought would be easy to do and that were really important to get to, as Dr. Chan said. But it may be something that if that works out effectively, we might take it to the next level and spread it out to more places if it helps us. Sorry, I think I cut Mackenzie off, Phil.
We know hospitalization rates are a lagging indicator as we're seeing COVID numbers increase, and I know that the new restrictions you announced just went into effect last week, but how long are you willing to wait before implementing new restrictions statewide?
I'm not willing to wait any time at all. As we see fit, we'll change them if it's an hour or a day. I mean, we take action pretty quickly, as we have for the past 9 months, probably more aggressively than anybody in the country.
What do you say to Marylanders who are fearing that there might be a second lockdown coming that might be more restrictive than the first time you went through this back earlier in the year? Not only business owners, but people who are watching this tonight.
Well, I can only just reiterate what we've said. My goal is to keep as much of our economy open, as many people working, and our lives as normal as possible, while we're also trying to keep people alive and keeping the hospitals from overflowing. And we're just making those decisions as best we can every single day. I understand the concern of people. I mean, I'm one of those people that is concerned. We're all concerned. None of us wants this to happen. But we're going to take the decisions we have to make. And I don't know what the definition of a lockdown is. We never really had a lockdown. We didn't even have a stay-at-home order. We had stay-at-home advisories, and many states closed everything. We kept 70% of our economy open the entire time. But might we have to take more restrictive actions over the coming, weeks or months? Absolutely, we might.
Governor, I just want to get back to some of the funding. $70 million is a lot of money. But the CARES Act was a while ago. And we are now heading into a 3-month period where, as we heard the other day, it could be even worse than what we originally had. You told us that the Vice President has been a partner with the governors. Is your message being communicated to him and to the administration? Because without any more action in the next 3 months, the scenario you've laid out here is troubling, to say the least. So the government in Washington seems to be more dysfunctional than ever at this moment.
Yeah.
Are they getting that message?
That's a really good question, Tom. I'm not sure. I mean, we're trying to deliver the message. Whether or not they're getting the message is another story. And it's not just the administration, but it's also Congress, with the potential turnover and changes, and them all focused on other things. This is a really tough time. PPP money ran out. CARES Act funding ran out. The stimulus bill was quite a while ago. I had agreement from the White House when I was chairing the NGA. I had agreement from the White House, from both sides in Congress. We were inches away from getting the 4th stimulus, but in April. We're now in November, and the virus is at the worst point ever, and we don't have the money. And I talked to my fellow governors. I talked to some today. I talked to some yesterday. We're very, very concerned with the continued gridlock, divisiveness, and dysfunction in Washington, while people's lives are at stake, and people's economic lives, and their mental health, and everything else.
Are people going to die as a result of this inaction?
They certainly could.
Governor, you've talked a lot about being cautious around family members during gatherings, limiting the size of indoor gatherings. We see a lot of local leaders that are now putting caps on even private gatherings. What are you and your family planning to do for Thanksgiving, since it's coming up in a couple of weeks?
Well, it's a great question. Thank you for asking that, because I am taking my own advice. We actually were hoping to get our family together. I was going to have my 3 daughters and my 3 son-in-laws and my 4 grandkids over to Governor's Mansion for a nice Thanksgiving, and we made the determination to cancel all those plans. Everybody, is going to stay home with their immediate families, and First Lady and I will be having hopefully dinner together by ourselves. But it's exactly what we're telling people. I mean, I don't know how you implement those kinds of orders that some of those counties are taking about what people do in their own house, but I have been strongly advising people that it's much safer, that family gatherings are the most dangerous thing that we have, according to our contact tracing, and we're taking it to heart.
Last question.
With the CARES Act funding, you mentioned the 48 days a couple times. Is there counties that are taking more time, and is there an indication as to why they're taking more time to spend this money?
Well, there were some of the county leaders didn't understand, I think, how it worked, and they were hoping maybe that Congress might change the law or that the administration might change some regs to say we're going to give you some flexibility. There were reports by some of you, and there was coverage, news reporting that the county leaders just said, hey, we really want to save this till next year and spend it later. And well, I know you'd want to, but the law says it has to go or you forfeit it all at the end of December. So we keep reminding them of the law. We don't believe it'd be great if we had more time, but the law isn't going to change, and we have desperate need right now. So we're just we're going to spend every penny the state has before the end of the year, and we're encouraging them to do so also. It's not like just excess money laying around that we don't need. We need the money, and we can't hold it till next year.